In today's video, we will find out what form of exercise can improve the overall strength and bone mineral density in older adults. We all know someone that is older, and soon so ourselves. But how are they in terms of strength? Are they independent, or do they need help due to lack of such? There was a 2022 systemic review in Springer Link by O'Brien et al. That looked at such topics. They compared resistance only versus combined resistance and weight-bearing training, frequency, volume, load, and length of the program. This is what they found. Based off of the 14 studies included, they concluded that progressive resistance training increased muscle strength and femur and hip BMD, but not the BMD of the lumbar spine. No training method significantly affected both outcomes. However, increases in strength and BMD were improved more by higher training frequency. Increases in just strength were favored by resistance only in higher volumes, and BMD were favored by combined resistance plus weight-bearing exercises, lower volumes, and higher loads. Let's take a deeper look at the review. They had included 15 studies to be assessed into the meta-analysis, but one was excluded due to the high risk of bias. Those that have watched my videos before know the importance of keeping a low level of bias. Out of the 14 studies included, 12 reported sex, which saw 92% of the participants were female with a mean age of 70. Mean program length of 43 weeks. An interesting point to make on the reported benefits of muscle and strength from the meta-analysis, 5 studies supplemented with calcium and vitamin D, which also has been shown to have a positive impact on the BMD and muscle strength. According to the risk of bias and quality assessment, 13 studies had an overall low risk, 1 study had some concerns, and 1 high risk. Overall quality of evidence was high for muscle strength, moderate for femur and hip BMD, and very low for lumbar spine. 65 to 70 age and over 70 group both showed improvements in strength and BMD, although the magnitude of increase favored the 65 to 70 group. Normalized BMI group showed greater improvements in muscle strength, but no differences in BMD to the overweight group. Strength improvements were significantly better following resistance training only and improved with a higher number of sets. For higher BMD in femur and hip, they were enhanced following resistance training plus weight-bearing / impact loading training, lower volumes and higher loads. Out of the 14 studies, 13 resulted in improvement in muscle strength, lower limb strength using leg press, while 6 of 12 studies showed an improvement in femur and hip BMD. Perhaps the lower improvement in BMD is because bone requires more time in loading as well as higher dynamic strains to maximize positive adaptations, whereas muscle does not. In terms of the lumbar spine improvement, only 1 of 10 reported a positive change, and even 1 study showed a decrease in BMD. Very interesting considering they used common exercises like the lumbar extension, seated row, and lat pull down. However, these were all performed in a seated or prone position, which would considerably offset the external load and strain through the lumbar spine, which is essential for triggering an osteogenic response. The evidence in the reviews suggests performing resistance and weight-bearing impact loading activities on alternate days to improve both factors. All studies have limitations, and the biggest one in this review is that only 8% of older men were included. The results found in the meta-analysis could be different if the match were equal, due to the men and women having different responses from resistance loading. However, in conclusion, the review does demonstrate that performing resistance training with a weight-bearing impact loading component 3 times per week training volume of 1 to 2 sets per exercise and an external load of 75 to 80% can improve muscle strength as well as BMD in the lower limbs.